Hello Karen, here's what my face looks like, and here is a safe version of a sciatic nerve glide, which is intended to gently move the interface between the sciatic nerve and its surrounding tissues, thereby restoring blood flow to that tract. That's to say the lower lumbar spinal cord, its sheath, as well as the sciatic nerve and its nerve siblings exiting the hip. The key here is, number one, to take the slack out of the system, and number two, to move that system, move the end points of that system with breath. So I'll show you what that looks like. Number one, taking the slack out of the system. We have to be in a supine position. We can choose to be very supported with pillows under our head. That's great. Or we can just come into a crunch. Effort is not required though. So taking the slack out of the top of the system is head and upper chest flexion. Taking the slack out of the bottom is bringing the leg into flexion until a little bit of tension is felt in the hamstring. Oftentimes it's easy just to cross that leg over the other thigh, straightening the knee, dorsiflexing the foot until tension is felt in the back of the leg, not pain, or not an increase in pain at least. And from this position, I imagine a string between forehead and toes, and then I'm going to point my toes while following with my forehead, taking a deep breath in and out. That's one end of the motion. Then I'm going to let my head down just a bit and follow back with my toes, taking a deep breath in and out. That's moving the end points with breath. So as I do this direction, toes that way, head that way, breathing all the way in and out. The sciatic nerve actually slides toward my head, and then when I bring my head down a little bit and wind up the toes, breathing, the sciatic nerve will slide a little bit this way. So try something like 4 to 6 repetitions, take a break, make sure nothing feels worse. It should feel like a gentle warmth or a breeze running through the back of the hip, at least not an increase in pain, should feel looser than the other side. And speaking of the other side, try also on the other side. Take the slack out first, so flexion, head and chest, flexion at the hip, extension at the knee, winding it up so that the forehead and the toes are drawing toward each other. And then when the toes point, the forehead follows, breath in and out. Forehead comes down a bit, toes follow, breath in and out. 4 to 6 repetitions. Take a pause. If there is no increase in pain, feel free to repeat the whole sequence again, both sides. And that should leave sciatic nerve and associated nerves with a little more blood flow, a little more freedom to move, and it should be a safe way to potentiate our results from today. I wish you luck with that, and hope that we didn't make you too late to the next thing in your day. Bye-bye.